Our presentation is on midwives and midwifery practice around the world.
Worldwide, there is a massive deficit in maternal care in both developed and developing countries. There is currently a global shortage of 900,000 midwives, which is 1/3 of the required workforce. The State of the World of Midwifery came out with a report in 2014 stating how dire the need for midwives and better maternal and children's care is. However, the progress since it came out has been slow, and if the improvements continue as they are now, there will only be slightly better care by 2030. If more midwives came into the workforce, 2/3 of maternal and infant deaths could be prevented by 2035, meaning that 4.2 million lives could be saved. Some of the major reasons for the deficits are gender inequality and pay deficits. Gender inequality is a problem because women's and reproductive health is still not prioritized as it should be, especially considering how many deaths there are worldwide. Midwives improve the care of women and newborns when there are adequate resources and support. Midwives are not paid enough for all the work they do, which has led to changing professions and leaving midwifery. Going to school for midwifery is expensive, and there are not many programs to help with funding or grants, and there are a lack of programs compared to the need. One of the major factors in the decreased number of midwives and maternal care deficits internationally is COVID-19. This has created a more dire need in other health services, which midwives have been placed in, and sexual and reproductive health has been put on the back burner. Midwives in other countries provide an all-encompassing approach to women's and infants' health care and see women from puberty on. Some midwives even see children. In a lot of countries other than the U.S., midwives are the main provider in the delivery room, provide home visit follow-ups when postpartum, and insurances recognize the need and desire for midwives so they are covered in health plans. This chart shows the mortality rate of women and children in different countries. The incidence of maternal mortality is highest in Africa and Asia and higher in the least developed countries. The majority of developed countries have more midwives than OBGYNs, with the exception of the US and Canada. The midwives provide the majority of women's health and reproductive care, and OBGYNs are reserved for high-risk pregnancies and deliveries. Some countries, such as Germany, always have to have a midwife in the delivery room, even if an OB is delivering the baby. Iceland, Norway, and Switzerland have the most midwives per capita in the world. Though this problem is worldwide, the need for midwives in developing countries is especially needed due to a lack of access to care or providers available at all. A lot of women are either poor or isolated and usually have no means to get to appointments or no healthcare services anywhere close to home. This leads to women delivering at home, a lot of times without a provider. 92% of all maternal and newborn deaths were in low to middle income countries. A shocking number of these deaths were from postpartum hemorrhages. These midwives provide more of a role such as the granny midwives, where they travel to different homes and help women deliver versus in a hospital or birthing center. Africa and Asia have 78% of births worldwide, with only 42% of the 300,000 birth providers. This explains why these countries have the highest rates of deaths. Midwives provide more of a holistic, hands-off approach to birth worldwide.
So a lack in investment in midwifery education is a huge problem internationally. This affects predominantly low and middle income countries. There's a lack of education, skilled educators, supplies, access to clinical sites. All of these lead to variability in the quality of care. Also, a lack of consistency in the use of the term midwife makes it difficult to discern who's been trained by the international standards. Gender equality also plays a large role, meaning there's less access to education and lack of power to make changes. So the importance of international standardized education, midwives provide primary and reproductive health care to conflict-afflicted areas and underserved areas. Standardization of education and quality of care can avert more than 80% of all maternal deaths, stillbirths, and neonatal deaths. Midwifery standardized education also improves other health-related outcomes and increases the effective use of resources by decreasing unnecessary and costly interventions. On this page, you can see an overview of the essential competencies for midwifery practice put out by the International Confederation of Midwives. In 2019, the World Health Organization published a framework for action for strengthening quality of midwifery education. On this slide, you can see the 7-step strategy for action to improve international midwifery education. So something that we mentioned earlier was a lack of consistency in the use of the term midwife. ICM defines midwife as a person who has successfully completed a midwifery education program that is duly recognized in the country where it is located and is based on the ICM essential competencies for basic midwifery practice and the framework of the ICM Global Standards for Midwifery Education. who has acquired the requisite qualifications to be registered and or legally licensed to practice midwifery and use the title midwife, and who demonstrates competency in the practice of midwifery. So some of the main goals for regulation is to set up and define the scope of practice for midwives, standardization of education, registration, relicensing, and continued competence, taking care of any complaints or disciplinary matters, and writing a code of conducts and ethics. The International Confederation of Midwives Global Standards for Midwifery Regulation was developed in 2011 and updated in 2019. This provides a framework to strengthen the midwifery profession and raise standards of midwifery practice. This is most urgently needed in countries that do not already have regulatory practices. These standards can provide a guide for developing midwifery regulation in these countries by collaborating with governments, regulators, and policymakers, also setting up a time frame for the implementation. In more developed countries, this is used as more of a guide for regulation and future goals to be set by those organizations.
The scope of practice for midwives around the world is pretty much the same. They care for and support women and families through pregnancy, labor, and birth. They utilize preventative measures to avoid complications. They promote normal birth. They educate and counsel regarding health in the antenatal period, as well as preparation for parenthood, sexual reproductive counseling, and care of the newborn infant. Settings of practice vary for midwives around the world, but these settings include the home, clinics, hospitals, birth centers, doctors' offices, and private practices. And then it's really important for midwives that they incorporate evidence-based research into their practice, and it does follow the midwifery model of care to do so. There are some challenges that they face with implementing new research, and that is collegial support, administrative barriers, or just insufficient time. Barriers to midwifery care include sociocultural, economic, and professional barriers. In the sociocultural category, we have that childbirth is often viewed as dirty, or it takes low skill for birth workers and is women's work. Culturally, women talking about sexual health in front of men is either discouraged or completely forbidden. Cultural practices surrounding childbirth sometimes overshadow following evidence-based practice. For an example, would be like skin to skin. They would hold off on providing skin to skin because of cultural practices saying that the infant was dirty and needed to be washed prior to the mother holding her. And then there's fear of sexual assault or lack of safety for midwives in certain countries. The economic barrier is mainly due to wages or insufficient wages. Sometimes when midwives require payment up front prior to providing all their services, there is a distrust of midwives. And then this can lead to low motivation, loss of satisfaction in the job, and low self-esteem. One of the most significant professional barriers is the lack of investment in education for midwives. But then there's also discrimination from doctors, lack of autonomy, lack of regulatory bodies or professional associations. There's inadequate staffing and heavy workloads. And then there's often not enough resources or unsanitary environments and poor working conditions.
So advocacy, what can we do? Well, there are lots of different organizations that are around the world. As midwives in the U.S., we can be donating toward the United Nations Population Fund, visiting their websites, staying informed, sharing what we know, increasing awareness and political support. I thought this was a cool idea, twinning, which is partnering your local midwifery association with a midwifery association in another country to share ideas and to advocate for each other. There's also the White Ribbon Alliance, which is a group of multinational NGOs, and they are fighting for women's rights and healthcare access. Their motto is Ask, Listen, Act. These are the top 10 tips for advocacy from the White Ribbon Alliance. They asked 10 international midwives what their advice was and how to advocate for midwifery, and these are their top 10. So take responsibility, never give up, get the support of women, be one team with one voice, collaborate, be convincing, use evidence and stay positive, be strategic, stay focused on women and babies, and be bold. Associations. NGOs who work globally for midwives. There's the International Confederation of Midwives that are working in 119 countries. Our ACNM here in the U.S. has a global outreach program. There's the Global Midwives Hub, which is a website that is dedicated to data collection, direct entry from midwives around the world with their statistics and data. And then they produce those statistics that are available by content and region. They have networking and free skills education coming soon. We have collaborative partners, so other organizations that are not necessarily midwives, but that we work together with, like the International Federation of Gynecology and Obstetrics, International Pediatric Association, International Council of Nurses. There's also the UN Populations Fund, UNICEF, and the World Health Organization. And a lot of those have come together on different projects. For instance, the Populations Fund, UNICEF, and WHO came together for the Framework for Action, which is a multi-agency task force. And part of their agenda is to strengthen midwifery education around the world.
The Millennial Development Goals emphasizes 3 areas in human and capital, infrastructure, and human rights, with the intent of increasing living standards. The first goal is to eradicate extreme poverty and hunger. The second is to achieve universal primary care. The third is to promote gender equality and empower women. The fourth is to reduce child mortality. Number 5 is to improve maternal health. 6 is to combat HIV and AIDS, malaria, and other diseases. 7 is to ensure environmental sustainability, and 8 is global partnership for development. Every woman should have access to a nurse midwife. The ultimate goal is to make midwifery care available to women worldwide. And midwives are the worldwide primary provider for natural birth. The ICM and Direct Relief share a mission to improve maternal and newborn health globally. They work together to empower midwives to inform policymakers of their vital role in saving lives and strengthening communities. InternationalMidwives.org is home of the International Confederation of Midwives. The ICM envisions a world where every childbearing woman has access to a midwife's care for herself and her newborn. Their strategic plan of 2021 to 2022 has 3 priorities. Priority number 1 is to drive innovation and sustainability for the future of midwifery. Priority 2 is to develop, strengthen, and support the rollout of a new professional framework for midwifery. Priority 3 is to foster a movement for midwifery, enabling and strengthening partnerships, advocacy, and communications for midwifery with women's voices at the center. Cross-cutting is the promotion of gender equality by employing a gender lens and prioritization across all elements of the strategic plan. Autonomy in midwives simply implies that midwives determine and control the standards for midwifery education, regulation, and practice. The International Code of Ethics for Midwives includes 4 main topics. The midwifery relationships covers the partnership with individual women, their families, and other care providers. The second is the practice of midwifery, which covers the care that is provided by midwives. And the third is the professional responsibility of midwives, holding confidence in client information and being responsible for their decisions and actions. The fourth is advancement of midwifery knowledge and practice. They are to advance their knowledge based on activities that protect the rights of women and persons. The code addresses the midwives' ethical mandates in keeping with the mission, the international definition of the midwife, and the standards of ICM to promote the health and well-being of women and newborns within their families and communities. And the ICM sets forth the following code to guide the education, practice, and research of the midwife. Bill of Rights for Women. Every woman has the right to receive care in childbirth from an autonomous and competent midwife. Every newborn baby has the right to a healthy and well-informed mother. Every woman has a right to be respected as a person of value and worth. Every woman has a right to security of her body. Every woman has a right to be free from any form of discrimination. Every woman has a right to up-to-date health information. Every woman has a right to participate actively in decisions about her health care and to offer informed consent. Every woman has a right to privacy, and every woman has a right to choose the place where she gives birth. Bill of Rights continued. The midwife rights. Every midwife has the right to a midwifery-specific education that will enable her to develop and maintain competency as a midwife. Every midwife has the right to practice on her own responsibility within the International Confederation of Midwives' definition and scope of practice of a midwife. Every midwife has the right to be recognized, respected, and supported as a health professional, and midwives have the right to access a strong midwifery association that can contribute to midwifery and maternity policy and services at a national level. Women's and midwives' rights together. Midwives and women have the right to a system of regulation that will ensure a safe, competent, and autonomous midwifery workforce for women and their babies. Midwives and women have the right to national midwifery workforce planning to ensure sufficient midwives to meet the needs of women and babies. Women and midwives have the right to be respected by governments and government institutions for health and education. The midwifery profession has a right to be recognized as a separate and distinct profession.